that all the obstacles and the checking points can be removed. For people who are going in and out of the communities, they have to show the green code, the health code, and these people will be exempted from the body temperature check. For delivery men and home service agencies, and people who are not residents of the communities, they have to present the health code in order to go and in from the communities. And third, we will continue to open the public facilities in an orderly manner. With careful consideration, we will start to open up shops, parks, scenic spots, and gymnastics and libraries, museums, galleries, etc. And we will also take a strict measures to control the traffic and the volume of population flow in those areas. And for some indoor facilities, including some of the places who are located in the basement or places with poor condition of the ventilation, different cities will evaluate their local conditions and reopen these facilities in an orderly manner. Fourth, we will open up the conventions and exhibitions in an orderly manner. We need to make sure that all the people who are visiting these places wear face masks and get their body temperature checked. So if everything is under control, that we would reconsider to organize exhibitions or sports events in an orderly manner. And fifth, we will reopen schools in an orderly manner. We will roll out nucleic acid tests to all the faculties. And for students who are coming back to Hubei province from low or high risk regions, they have to receive nucleic acid test. So for people who are going inside of the schools, they have to have their body temperature check. For outdoor activities, we do not need the students to wear face masks. When people are staying indoors, they have to wear face masks. After a period of time, with careful evaluation, these students will not have to wear face masks anymore. Six, we will restore the medical system in an orderly manner. For cities with low risks, people do not have to wear face masks. But we have to roll out nucleic acid test and serum analysis to patients who came to the hospital with a fever. As seventh, we will improve the procedures of the nucleic acid test. For close contacts of the COVID-19 patients and people who are coming inside of Hubei province from high-risk countries, and people who are working in the airport, altogether 8 types of people, we have to make sure that all of these people will receive nucleic acid test. So for different cities, they can analyze their actual situation to make sure that all people can receive nucleic acid test when necessary. On top of that, we have to improve the awareness of our public, the member of the public, so that they can formulate a good habit for the prevention and control. And also we will educate the general public to improve their awareness for prevention and control of the infectious disease. We will encourage our public to have to exercise a very strict social distance and to put their garbage based on categories, so that all the societies can be lifted out of the risk. Thank you. Now is the Q&A session. Before you raise your question, please identify yourself. Thank you. With Xinhua News Agency. Now we have adjusting the emergency response level to level 3. So what measures will be taken by Hubei province to make sure that we can implement a regular prevention and control? So I would like to give this question to Mr. Liu Dongru. Thank you for your question. Now we have adjusting the emergency response level to level 3. We will focus on the following 3 areas of work. First, we will stick to the 3 unchanged. First, we will continue to strictly follow the guidance from the Hubei Provincial People's Government and the Prevention and Control Mechanism. And the second, we are making sure that the territorial responsibilities and the 4-party responsibilities remain unchanged. Third, we will make sure that the strategy of prevention of imported infection and domestic recurrence and targeted prevention and control and treatment remain unchanged. And we also need to make sure that the 4 early measures need to be implemented in an orderly manner. Second, for the regular prevention and control work, we have to define all of our specific works, so we should not slacken off in our efforts. And we have to stay sober and be determined and always prepare for the worst scenario so that we could making sure that we can win this battle against COVID-19. And we have to, under unified guidance and coordination, to make sure that we have a unified understanding and actions so that we will not see a resurgence of the virus. And for specific groups of people, we still have to take strict measures to make sure that these people will not carry virus or transmit the virus to the other places or other people. So for major public places, we have to roll out thorough disinfection and ensure good ventilation of these places. And third, we have to improve our weak links in our jobs that has been carried earlier. We found that we do have some weak links, especially for the management for some communities. So we have to strengthen our counseling to people who are infected with COVID-19. We will continue to formulate guidance to make sure that we are taking a scientific approach to prevent and control the virus. And third, we will strictly abide by the guidance made from the Hubei Provincial People's Government and to respond to the adjustment of the emergency response level. So even now we could see the adjustment has been changed to level 3. So we will relax some of the restrictions in our prevention and control so that we can ensure that the work resumption can be implemented. For different localities, we have to strengthen the education of the policies to make sure that all the general public can understand the latest policies from the government so it can help people go back to their normal life. Second, we will provide more professional trainings to relevant personnel. Though we have adjusting the emergency response level, but still at the same time, we have to remain vigilant, and we also have to empower our officials to go to the communities and to the grassroots to making sure that all the prevention and control measures can be implemented in an accurate manner. Third, we will improve the supervision work. To places who practice formalities and bureaucracy, we will hold relevant personnel and the government, local governments accountable. And also we will strengthen the law enforcement and to find out all of the illegal acts. So here I encourage members from the public to monitor and supervise the situation in Hubei province, and I hope you could supervise our work in the regular prevention and control, and I welcome all of your feedback. Thank you. Next question, please. With CMG CCTV. Now we have adjust down the emergency response levels. What measures will be taken by the provincial government so that we can better guide the public to get used to the new normal? So it is very essential to take a scientific prevention and control measures for the containment of COVID-19. If science is considered as our strategy, that targeted implementation is our tactics in the containment of the virus. So we have organized experts to formulate guidelines for regular prevention and control. So these guidelines will be provided to all the public facilities and the people from the public to understand the specific requirements. So right now, we have formulated 4 types of technical guidelines in the epidemic prevention and control altogether, comprising with 33 measures. And recently, we also published the guidelines that has been released by the Joint Prevention and Control Mechanism of the State Council. For all of these technical guidelines, touch upon all aspects of our social activities, also covers a wide range of topics that concern our general public. We have to make sure that our people are accountable for their own health. So I appeal to them to have a good hygiene habit and reduce the mass gathering and form a new way of living so that they can improve their awareness of health. And I appeal all the people to abide by the requirements that has been published by the Hubei Health Commission. I hope all members of the public can work together with the Health Commission so that we can better contain the virus in Hubei province. For families, we encourage them to ensure a good ventilation and to sanitize items on the furniture on a regular basis, and make sure that you do not go to densely populated places. And if you run into people who have bear with fever, make sure that you wear a face mask and exercise social distance with these people. To hospitals and fever clinics, I encourage all of these hospitals to come up with a contingency plan. Make sure that all of these medical institutions have a guideline in place and have sufficient supply, and also conduct epidemiology investigations to all the suspected cases. I believe all of these guidelines play a key role in containing the COVID-19. I hope all of us can abide by all of these guidelines and form a good habit and to improve your health conditions. So for all of these guidelines, you can have access to all of those documentation in our official website of Hubei Health Commission. So by having all of these guidelines in place, you can provide instructions to your companies and also your family members to protect themselves. Thank you. So now I would like to give the floor to Mr. Li Qiang. Thank you for your question. Now we have adjusting the emergency response level to level 3. Right now we are in a situation that we are able to resume our work and resume business and resume our classes. And now we are in the process to recover the social and economic activities in Hubei province. And for some of the measures are adjusted in line with the adjustment of the emergency response level. Now we have made the following work. First, we have changed some of the restrictions measures in communities. Where necessary, we will open up the communities to the public. And the second, for people who are going in and out of the communities, these people, if they show a green code and a house code, they don't have to take the body temperature. And for people who are not residents to those communities, they still have to take their body temperature and show their house code. And at the same time, we will gradually open up the public facilities to the public. So one point I want to emphasize that we will not relax our efforts, even though we have made adjustment of the emergency response level. At this point, we have to cherish the hard-won efforts and contribute to resume our business in Hubei province. Thank you. With people's daily. So for Hubei has made the adjustment of the emergency response level, and I believe some of the prevention and control measures will be changed in Wuhan city and people will go back to their normal life. But still, we realize that some residents in Wuhan, they're still concerned about the situation. So what's your take? So Mr. Wei Sheng, please take the question. Thank you for your question. I think Wuhan is the most safest city right now. So please rest assured and recover your daily life. Because in the last months, we have rolled out a all-rounded nucleic acid test in Wuhan city. And we only identified 300 asymptomatic patients in Wuhan city. It shows that, first, with the large-scale screening, we don't have any confirmed cases in Wuhan city. And the second, for all the asymptomatic cases we identify in Wuhan city, none of them develop into confirmed cases. Third, among 1,700 close contacts for the asymptomatic patients, none of them show positive in COVID-19. And third, we also screen out the throat swab of the close contacts of the COVID-19 asymptomatic patients, and we also found 0 positive cases for those people. On top of that, on June the 1st, Wuhan also takes samples from the water and also conduct a large scale of ultra-environmental samples. So altogether, we have gathered over 20,000 samples. So none of those samples tested positive in COVID-19 virus. So also we found there are major achievements made from Wuhan city. Start from April, there is no new death reported in Wuhan. And start from May the 31st, there's no more asymptomatic cases reported in Wuhan city. And also on June the 3rd, we found that all of the severe cases are discharged from the hospital in Wuhan city. And start from June the 4th, all confirmed cases are discharged from Wuhan city. So actually, Wuhan is a heroic city, so please rest assured and try to recover your daily life. Thank you. So last question. With Hubei Broadcasting Center. Now we have made adjustment of the emergency response level. I want to further understand in what circumstances that the people from Hubei province have to wear a mask and in what other circumstances that these people do not have to wear a face mask. First, thank you for your question. So now we have adjusted the emergency response level to level 3 in Hubei province. in accordance with the guidance of the public health in Hubei province. So I would like to advise that for people who are living in Hubei province, please form the habit to bring a facial mask with you, and when necessary, please wear the face mask. And for places with good ventilation and good health conditions, you don't have to wear the face mask. And if you are visiting a restaurant, shopping malls, gyms, meeting rooms, and places with densely populated, please wear a mask. And if you're visiting places that is densely populated, and also if you are visiting the hospitals, please wear a mask. And also, I would like to send out a reminder, please bring a facial mask with you. And for key groups of people, when necessary, please wear a mask. Last point, if you're not wearing a facial mask, please make sure that you can maintain a 1 meter distance with others and wash your hands frequently. When necessary, please use sanitizers. Thank you.